Hey everyone, it's estimated that 1.1 billion women will be postmenopausal by 2025. That means that a lot of women are going through the perimenopause transition. Many of you may not even realize that some of the symptoms you're having are related to these hormonal changes and this highly symptomatic time in life. So let's jump into what perimenopause is and some ways to know that you may be experiencing perimenopause symptoms. And we'll talk a little bit about how to know when to see your provider. Menopause occurs most oftenly between the ages of 50 and 52, but women can experience menopause anywhere from the age of 45 to 55 and have it be considered in the range of normal. Menopause is when you've not had your period for 12 months at the end of your reproductive phase of life. There are women who experience menopause prior to 45 and after 55, but that's much more rare, about 5% or less of women going through that transition. Perimenopause is the time around menopause. It's the years leading up to that 12-month stretch of no cycles. Your estrogen, your progesterone are the main players of your reproductive hormones, and they're starting to putter out. Your ovaries, which generate the majority of your reproductive hormones, are losing their strength. As a result, our bodies start to change. I like to break down the perimenopause stage into an early menopause transition and a late menopause transition because they can look very different. Your early menopause transition is going to be noted by some cycle irregularities, your period coming a little late or a little early, give or take about 7 days, for about 10 months or so of your year. Hormonally, you're going to be having fluctuations in the hormones that are trying to get your ovaries to generate more hormone. Your body's losing steam, your ovaries are losing steam. Your body's revving the engine to get those last eggs out as a chance to become pregnant. The labs we do in this stage are often not directly testing estrogen and progesterone, although we can and do, but sometimes we're checking follicle stimulating hormone to assess how hard your engine is revving. The late menopause transition is an extension of the early menopause transition, but more severe. You may have 60 or more consecutive days of no period bleeding for women 45 and plus, or about twice in 1 year having this type of stretch in a woman 40 to 45. This irregular time frame may last about 1 to 3 years, and your hormones will continue to fluctuate. We're going to see your follicle stimulating hormone going up and down even more, and increasingly, your cycles may be what we call anovulatory cycles, or cycles where you don't produce it. That doesn't mean that you can't or won't occasionally, but more often the cycles will not result in ovulation as you get closer to menopause. Hindsight is often 2020 when it comes to perimenopause, where you look back and you think, that's why I was acting that way, or that's why that change was happening. But if you have a little bit of information around perimenopausal symptoms, you can really be aware and manage your expectations and improve your quality of life. There are also a few red flags to look for that you don't want to miss. So, when we talk about figuring out if you're in perimenopause, the main ways that your provider is going to do that is through clinical assessment, which is a really great conversation with you and learning more about what you're experiencing, as well as some labs and potentially some imaging. Now, often we can identify that a woman is perimenopausal simply by talking to them. The labs often are to support that diagnosis and or to rule out other causes of the symptoms of menopause. So it is important to work with a provider who's knowledgeable and can help you identify that what you're experiencing really is perimenopause and not a similar but different medical condition. Perimenopause can be an incredibly confusing time, especially if you have no one to talk to about what you're experiencing. I hope this short video helps just get you a little bit of information about what might be going on during your perimenopause transition. I hope that you'll subscribe and stay tuned for more videos. I want to answer questions that you have and address the concerns that I am seeing from my patients. So let me know if there's a question you have or something that you want to learn more about, and I will share it here on our channel. Thank you again, and I look forward to seeing you soon.